This is a short video on the basics of the Affordable Care Act, also known as Obamacare. My name is Reeve Conover, and I've been an employee benefits consultant for individuals and businesses since 1986. First things you need to know are some of the basics about the Affordable Care Act. When the law was written, they built into it 10 essential benefits that have to be covered by all plans, whether it's group, individual, Medicare, or Medicaid. You see, there's no such thing as an Obamacare plan. All plans are governed by Obamacare. So in those essential benefits, for example, there are no more pre-existing conditions anymore. In those benefits also, all preventive care is covered 100% regardless of what your deductible is. The next thing is the metal levels, the different levels of coverage. So bronze plans typically are high deductible plans, and sometimes they're referred to as switch plans. You pay the first $5,000, then the switch is thrown, and the insurance company pays everything after that. In those cases, they're typically eligible for a health savings account, and they are going to be the least expensive options, but they're also the least coverage. Most people opt for silver plans, especially if getting a subsidy, which we'll talk about in a few minutes. So silver plans are copay plans. They're more typical to what you're used to. And then the two layers above that, if you can even find a platinum plan, gold and platinum plans are much richer benefits and a much higher pricing point. Also know that the Affordable Care Act allows the insurance companies to charge more for smokers. Some do, some don't. But in general, the Affordable Care Act is not affordable. It hasn't made this easier. And there are no such thing as private plans, something that you can buy on the side that isn't an Obamacare plan. They've been eliminated. There are some limitations on when you can join and get your health insurance. You can't just join any old time you feel like it. First, there's the annual open enrollment period, which is for January 1st coverage, and it runs in November to mid-December. Very often they extend those dates. At that time, you can take a plan, you can add people, take people off, you can do whatever you want. During the year, if you qualify, you may be eligible for a special enrollment period. This means that you can now join the plan within a very tight window. You have 60 days from the date that the event occurs in order to join. So if you have moved to a new zip code, you've gotten married, divorced, legally separated, you've had a birth, a death, or an adoption in the family, all of those will allow you to get a special election period. Also, if you've lost coverage through no fault of your own, you've lost your job, your employer's dropped insurance, whatever it is, that would also give you a new special election period. Subsidies. The reason that most people go to the healthcare.gov website is to get a subsidy. And this is kind of an interesting and somewhat dangerous area. Here's the chart. As you can see, if you're single and you make $17,236 or all the way up to $49,960, you're eligible for a subsidy. The less you make, the more the subsidy will be. If you're a family of four, the government will subsidize your premium all the way up to $103,000 in income. Now, here's the thing. There's a bunch of things you need to know about this chart. First, what if you make less than the minimum? Well, then you would, in some states, in the blue states generally, be eligible for Medicaid. In most of the red states, you would not be eligible for Medicaid because those numbers are much lower. So, for example, in South Carolina, if you make less than $17,000 but more than around $8,000, you're in a hole. You don't make enough to get a subsidy, but you make too much for Medicaid, and that means you get to pay the entire premium yourself. Also, know that this is based on your modified adjusted gross income for the year in which you have coverage. So it's 2020. and you decide that you're a real estate broker and your income bounces around, and so you're not really sure, but you decide you're probably going to make 30 grand and you're single. So you're going to get a subsidy. You're going to be in that subsidy chart. But you have a good year and you sell a couple extra houses and now you made $51,000. Well, you will owe back all of the subsidy money that the government paid on your behalf. There's no partial year credit. Oh, I needed it from January to June and then I got a good job. Nope, you're going to have to give all that back. I have seen people have to give back as much as $21,000 in tax money. So be aware of this. And if you're going to go this way, I strongly recommend you chat with a broker that understands the Affordable Care Act before you make those decisions. There are some limitations you need to be aware of as well. Most of the teaching hospitals, the tertiary care hospitals, don't accept Obamacare reimbursement rates, and they don't join these plans, and that's kind of an issue. For example, in New York City, NYU Langone system decided that they were not going to accept payments on any of these programs, and it made it very hard for people to get care from their hospitals that they needed. Secondly, most plans have smaller networks than the commercial product. So if you had a plan from your employer and the doctors were all in it, and now you go to an Affordable Care Act plan, you need to recheck to make sure your doctors are in the plan because they may not be. Third, most plans do not allow out-of-network coverage. In fact, we work in 16 states, and I have not yet seen any Affordable Care Act plan that allows you to go out of the network and get reimbursed. And the last thing is that not all, but most plans that we have seen don't provide you coverage out of state. On your group plan, you may have a Cigna National Network or a Blue Cross National Network, and you can go anywhere in the country. That will not necessarily be true on the Affordable Care Act. So here, it's critical that you do the research and find what the status of your hospitals and providers are. You're expected to enroll on the local exchange program. For most of the country, that's healthcare.gov. For some individual states like New York, it's the New York State of Health, but you enroll online. It is designed for you to be able to enroll yourself, but that's not necessarily easy for a lot of reasons. First, there are an awful lot of exceptions built into this. So in order to determine whether or not you qualify for an exception, you have to answer a whole pile of questions that may seem weird because you don't understand why they're asking them. The second thing is, if you're a plain vanilla situation, husband, wife, 2 kids, this is simple. But if you're not plain vanilla, if you're rocky road, if you're divorced and one of the kids lives with you and 2 of the other kids live with your ex-spouse, well, it's going to be a lot more complicated and it's going to take a lot more time. Know that if you make one click on this website that is wrong, it will completely change your enrollment. So most people go to brokers for advice and guidance. And if you go to a broker, somebody like myself, we can help you research your networks and answer a lot of questions and kind of give you some direction on what probably is the best place for you. Now understand that brokers get paid very little for this. The commissions are very low, and a lot of brokers for that reason don't even touch this. And if you choose a plan that doesn't pay commissions, then you're going to have a conversation with your broker about how they're going to be compensated and how they're going to service you. So to summarize, you need to understand the plan that you're looking to buy. You need to understand high deductible plans. You need to figure out, am I better off on a high deductible plan in all circumstances, or is there a time in which maybe I should spend more money and get a richer program? You need to understand when you can enroll and if you can enroll off cycle. You need to go through subsidies and the chart and figure out, if you are eligible for a subsidy. And then the other question is, should you take the subsidy and take the risk of the taxes? You need to know that the limitations, you need to research your provider networks, and then you need to actually get enrolled. If you don't have a broker that can do these things for you, you're welcome to reach out to us, and we would certainly do that. We work in 16 states. If you've got a broker, that's great, and wish you the best of luck. Have a great day.